So here we will be mainly studying four topics today. One is ESR, hematopoiesis, blood pressure, and ECG. You will have some idea regarding what is a ESR. ESR mainly means erythrocyte sedimentation rate. Erythrocyte means RBC. That is a erythrocyte sedimentation rate is a blood test that measure the rate at which RBC settle at the bottom of a test tube over a specific period of time, and usually it is 1 hour. Here you can see that how this test is conducted. We will be taking blood in a test tube. We will be adding anticoagulant to it, and you can see that just like any particle, blood cells will be also settling at the bottom of the test tube, and this settling is taking place at a fixed rate or at a constant rate. That rate will be same because here you can see that after 15 minutes this much amount of blood will be settling. After 30 minutes about around this much will be the settling, and after 1 hour you can see that around this much amount of blood will be settling down. And this rate or speed at which this settling rate or sedimentation is taking place is actually constant, and that is what we are measuring, and that will give you an idea about the different disorders mainly affecting our circulatory system. If there is some kind of infection, the ESR will be increased. Sometimes doctors will be telling that you have high ESR. That is why the cough is not still persisting. So high ESR are usually related with the continuation of cough. Similarly, if you have a worm infection like a roundworm infection or tapeworm infection, then only your ESR will be increasing. So the rate of ESR or ESR rate is somehow related with different disorders of our body. So how it is conducted, I have already explained. The blood is collected in a vertical tube and will be coated with the anticoagulant. So anticoagulant will be there, and for 1 hour we will be keeping the blood like this in the test tube, and we will be measuring the rate of ESR, rate of sedimentation or rate of settling down. So what is the significance of ESR is that it is a non-specific indicator of inflammation or any disease. So elevated or higher ESR can suggest conditions such as infection. Any kind of infection in your body can increase your ESR rate. So that is one feature. Then presence of many chronic diseases can be indicated by high ESR. And some autoimmune disorders like arthritis, rheumatoid arthritis, and that is happening due to some problems in the immune system. All these will be indicated by increased or higher ESR. Our ESR does not provide specific information about the cause or location of the inflammation. Doctors can only tell that if you have a high ESR, doctor will say that you have some infection, but it will not provide where this infection is localized. That information may not be available, but even that high ESR is enough for a doctor to pinpoint or to diagnose what will be the possible reason for that high ESR. Normal values of ESR can vary with the age of the person, the sex of this person, and also the type of test that we will be applying. Typically, it will be falling between 0 to 15 mm per hour for men and 0 to 20 mm for women. So that is the normal value for men and women, and because men have a higher amount of RBC in their blood. So that is why the settling rate will be slow in men, where it is be more faster in women. So that is the slight difference between ESR between male and female. And elevated or increased values of ESR can be interpreted only on the basis of what is the, for example, when you have a cough, doctors usually say that you have high ESR and doctor will prescribe some medicine to reduce that high ESR, then only the cough will go. So this is an idea regarding how ESR will be measured and how ESR rate is actually influencing the various functioning of your body. Now another is hematopoiesis. So going to the hematopoiesis, hemato means blood and poiesis means formation. So hematopoiesis is the process of blood cell formation and development. So that is known by the name hematopoiesis, and it involves production of RBC or production of red blood cells, white blood cells and platelet. So hematopoiesis, hemato means blood, formation of any kind of cell, whether it is RBC, WBC or platelet. All these are actually part of cell. So different types of blood cells are that formation of blood cell, whether RBC, WBC or platelets, can be considered as hematopoiesis. Now in the use of this hematopoiesis, there is a term known as stem cell. Sometimes you might have heard about that term, stem cell. Stem cell is actually a type of cell that can differentiate or develop into any other type of cell. That is a main definition of a stem cell. It can develop into any type of cell. So in the use of hematopoiesis also there are hematopoietic stem cell. Hematopoietic stem cell means such kind of stem cell can convert it into either RBC or WBC or platelets. So that kind of cell is known as a hematotypic blood cell. Here you can see that. So this is how the hematopoiesis or hemopoiesis are normally taking. Here you can find that one kind of cell is converting into megakaryoblast, which will be finally resulting in the formation of a platelet. Another is converting into proerythroblast, that will become a erythrocyte or RBC. And again another type will be converting into either myelioblast or monoblast. If it is converted into myelioblast, then it can form either eosinophil, neutrophil or basophil. Or if it is forming into monoblast, then it will be converted into monocyte. Then there is another possibility is that some of the hematopoietic stem cell can convert it into lymphoid stem cell, and that can again convert it into lymphoblast. And lymphoblast can divide to form different types of cell known as B lymphocyte, T lymphocyte or natural killer cell. So different possibilities are there. All these are actually forming from one basic fundamental cell, which is known as hematopoietic stem cell or hemocytoblast. So this hemocytoblast can differentiate into either myeloid stem cells or lymphoid stem cells. If it is converting into myeloid stem cell, different possibilities are there. It can form platelets, it can form erythrocyte, or it can form different type of WBC like neutrophil, eosinophil, basophil or monocyte. But there is only one possibility for lymphoid stem cell, that will be only forming lymphocyte. So different type of lymphocytes are there, B cells are there and T cells are there and natural killer cells are there. So this is how the hematopoiesis or hemopoiesis will be taking place. Now where this hematopoiesis are normally taking place? At the embryonic stage it occurs in yolk sac, and later this will be happening in liver or spleen. Whereas at the fetal stage means that from an embryo level the organs will be, the baby has developed a little more. At the stage of fetal, liver and spleen are the major site of blood cell production. Then postnatal stage, after that in adult, hematopoiesis mainly occur in bone marrow, particularly in axial skeleton like pelvis, sternum, ribs and vertebrae. So these are the bonds which are mainly involved in blood cell formation. You can see that pelvis, then that pelvis means our hip region, bonds in our hip region, sternum, this is the bond here, and ribs, and vertebra. These are the main bonds which are involved in the formation of blood cells in case of an adult person. Whereas in a embryo, it is mainly taking place in the yolk sac. So here also we have seen how this hematopoiesis or hemopoiesis is going on. Then here how this process is actually taking place. One is the stem cell. Stem cell means hematopoietic stem cells in the bone marrow differentiate into various progenitor cells. Here you can see that this is the hematopoietic stem cell that will be first converting into different type of progenitor cell, on either myeloid stem cell or lymphoid stem cell. That is the meaning of various progenitor cell. And this progenitor cell further differentiate into specific cell type. For example, erythrocyte produced from erythroblast. Here you can see that some of the erythrocyte are actually developing from erythroblast. Erythroblast will be developing into erythrocyte. And these carry oxygen from lungs to tissue and carbon. That is the main function of RBC or erythrocyte. Second is leukocyte. They are differentiated into several types, including neutrophil, lymphocyte, monocyte, eosinophil. So this is the case of the second type, that is the myeloid stem cell can differentiate into myeloblast or monoblast. So these are all progenitor cells. So this is the stem cell. From the stem cells we are developing progenitor cell. That is the second stage. Then come to the thrombocyte, derived from megakaryocyte, and here also you can find that megakaryoblast is converting into megakaryocyte that will be forming the platelets. So that is the case of the platelets, and their main function is helping in blood clotting and wound healing. The process is regulated by various factors like presence of erythropoietin RBC, cytokines, and they are ensuring the balance in the production of how much amount of RBC or how much amount of WBC should be produced. So this is an idea regarding how stem cells are converting into various type of. So try to remember this picture in your mind. If you know this picture, it will be more easy. This is a stem cell. They are first converting into progenitor cell, like myeloid stem cell or lymphoid stem cell. Then again another kind of stem cells will be forming. It is in the final stage only. The platelets, RBC, eosinophil, neutrophil, different T lymphocyte or B lymphocyte are all formed. So if you know the picture, it will be easy for you to explain. Now that is an idea regarding what is hematopoiesis. Then another topic that we have to discuss is around blood pressure. So in the issue of blood pressure, we have to first understand what is a blood pressure. It is a force exerted by blood against the wall of the arteries as the heart pumps it throughout the body. So that is when blood is flowing through the artery or blood vessel, it will be creating some force or pressure on the wall of the blood vessel or on the artery. That force is actually called as the blood pressure. And using certain mercury devices like sphygmomanometer, we can dictate how much is the intensity of this pressure, and that is normally what we call as the blood pressure. Typically there are two important terms in blood pressure. One is systolic pressure, another one is the diastolic pressure. Highest pressure in the artery when heart ventricles contract and push blood out. That is during the time of a contraction of a heart, the blood will be pumped out of the ventricle. So during that time, extra amount of blood is coming into the blood vessel. So during that time when heart is contracting, pressure of the blood in the arteries will be more. That pressure that happens during the contraction of the ventricle is known as the systolic pressure. So systolic means contraction, mainly the contraction of the ventricle. Then another pressure is also occurring. That happens during the relaxation of the ventricle. So that will be the lowest pressure in the artery when the heart's ventricle are relaxed and filling with the blood. So that is, there are two situations. One is the case of highest pressure, that is happening when ventricles are contracting. Another is the lowest pressure, that is taking place when the ventricles are in the relaxing state, and that is known as the diastolic pressure. So when you explain a blood pressure, you must explain what is a systolic pressure and what is a diastolic pressure, and how we are measuring blood pressure. And we have an instrument known as sphygmomanometer, and also using stethoscope. There is a mercury controlled device, and using that device, the doctor can dictate the intensity of systolic pressure as well as diastolic pressure. And we will be getting a reading, especially in millimeters of mercury. That reading will be normally, it is 120 for systolic and 80 mm of mercury for a diastolic pressure. So that is the range of 80-120 or 120-80 is known as the blood pressure. 120 means referring to the systolic pressure that takes place during the contraction of ventricle. Diastolic is the lower pressure that happens during the relaxation of the ventricle. So this is the normal thing. Then why we are measuring this blood pressure always? So whenever you go to a doctor with for example fever or some other problem, sometimes doctor will check your blood pressure, because blood pressure is an indicator. If there is some kind of abnormality or some kind of infection, diseases, okay, so that is the normal range. Normal range is 120-80. So if there is any kind of disorder, metabolic disorder, infection, or some diseases that will be affecting your blood pressure, so that will give you, doctor, whether your situation is a real situation, that you have something abnormal inside your body. So if a doctor feels that the pressure is higher, that indicates that there is some problem with your body. So that will be giving. Now other situation is that normally when especially in older person, after up to an age of 35, most of the people will be fine. Only in very few individuals the pressure is above this normal level. So if your pressure is measured, majority, almost 99% of you will have a pressure between 120 and 80. Some may have a lower pressure. Maybe for some people pressure may be 70 only. That is, from a lower, from birth, maybe their pressure may be low. Some people, especially women, have a lower blood pressure always. But after a certain period of age, normally after a period of 35, at the age of 30, after 35, the pressure gradually increases, especially if your body weight is increasing, and if you have if you have some other natural tendency, your father, mother have a history of higher pressure, then normally your pressure will start increasing after the age of 35. Then you can see that the pressure gradually increase from 120 to 130. Sometimes the pressure is more than 80, instead of 80 it comes to 90. Then we call it as a elevated state, a state of elevated or higher blood pressure. Now up to this age, there is nothing much to worry. You can go for a daily exercise without any kind of medication. You can control your pressure somewhat. You eat less, you work more, you exercise more, then it is fine. But if the pressure is again increasing, and reaching a stage of stage 1 high blood pressure. That is, what is the stage 1 high blood pressure? Pressure will be 130 to 139, and lower pressure, diastolic pressure between 80 to 89. Then you are in the high blood, you have become a high blood pressure patient. That means, so, and at that stage it is stage 1 high blood pressure. Then then we have to seriously think about controlling your pressure. Sometimes you may go for medication, and sometimes you may without medication, with the exercise, diet control, reducing body weight, you will be able to control your blood pressure. So the stage 1 is a warning stage. Now if pressure is again increasing and you are reaching stage 2, definitely you have to go for medication, because controlling stage 2 level blood pressure is not always easy. So 140 to 180, most of the people above the near the age of 40, 45, 50 or 55, during that age many people will be having pressure related problem. And that is the time when exercise become very important. And by daily exercise, by diet control, by reducing body weight, to some extent it can control, but not always. Controlling this stage 2 blood pressure by diet control and exercise alone may not be very easy. So if that stage is reaching, then you have to take care very carefully that you are in the blood pressure, you have becoming a blood pressure patient. Some people will have a very high blood pressure of 180, that is higher, and lower blood pressure of 120. That is you are going to a more severe stage of blood pressure. Only by proper medication only you can control that. So stage 2 to stay onwards, the chance of taking blood medicine for controlling blood pressure increase. So what is the problem if you are not taking any blood pressure, any medicines for that? The problem with the high blood pressure is that it won't show any symptoms. Even if your blood pressure is 140 or 180, unless a doctor is taking with a sphygmomanometer, you won't feel any discomfort. You feel you are okay. You don't have any problem. But the problem happens is that this higher blood pressure can damage your kidney nephrons. In the kidney there are very smaller tubes are there, and they are known as renal tubules or nephrons. The higher blood pressure can damage the renal tubules or nephrons of your kidney, and similarly your heart can be damaged by higher blood pressure. So that will be the problem. So if this higher blood pressure is going on for a longer time, that means for several years, it gradually destroy your kidney and also destroy your heart, and you will become either a heart patient or a kidney patient. So that is a problem. Sometimes the kidney may be completely damaged, then there is no possibility of kidney. Then only thing you can do, either you have to go for a kidney replacement or organ transplantation, or you have to take daily dialysis. So that is the problem of high blood pressure. High blood pressure is sometimes known as a silent killer. Why it is known as a silent killer? Because it does not show any symptoms. It doesn't show any symptoms. That is why high blood pressure is a dangerous situation. It doesn't show any symptoms. It is a silent killer, slowly killing the person over a period of several years. So that is why checking the blood pressure frequently is an important thing in maintaining good health. So that is also an important thing. That is why and high blood pressure and heart diseases are directly related. If you have high blood pressure, your chance of developing most of the heart diseases gradually increases. So this is the normal range of 120/80. Then blood pressure is influenced by cardiac output, blood volume, and vessel diameter and resistance. Vessel diameter means sometimes you have a higher body weight. A lot of cholesterol is there in your body. So that cholesterol will be depositing on the inner side of the wall of the artery. That will be reducing the diameter of your blood vessel and increasing your blood pressure. So that is one problem. Then autonomic nervous system and hormones like adrenaline and angiotensin also play some role in regulating your blood pressure. Then what is the clinical relevance? As I already mentioned you that persistent high blood pressure can lead to cardiac vascular disease, heart attack, stroke, kidney failure. So heart and the kidney are the main organs which are affected by high blood pressure. Similarly, low blood pressure, very low blood pressure can cause dizziness. Dizziness means a talagaram, that is a dizziness. Then fainting and also shock. So these are some of the problems associated with the low blood pressure as well as high blood pressure. Then we have one more, that is the ECG. About ECG also you have some idea. ECG is electrocardiogram. It's a test that records the electrical activity of heart over a period of time. So that is known as the ECG. Here I will show you what is how an ECG will be taking. Now if you look closer, you can see that in any ECG, this is how the normal pattern of an ECG, and we will be recording the electrical activity of the heart by using several electrodes. These are very fine electrodes. They are highly sensitive. They record the electrical impulses coming from your body, especially from your heart, and will be given a graphical output like this. Now if we increase that picture, you can see that this is there are three types of verb. One is P verb, R verb, T verb and U verb. So these are the normal types of verbs which are present in an ECG. So P verb represents atrial depolarization, which is electrical activity associated with the contraction of atrium. Atrium means auricle. So in a person, this first verb is known as the atrial depolarization. That takes place when your auricles or atrium is contracting. So during the contraction of auricle, atrial depolarization is taking place and P verb will be produced. Now that is the significance of P verb. Now second verb is the QRS complex that represents the ventricular depolarization, which is the electrical activity associated with the contraction of ventricle, and that is when ventricles are contracting, the second verb will be produced. So when your ventricles are contracting, the second verb will be produced in your body, and the second verb is known by is the result of ventricular depolarization, and this ventricular depolarization is actually the result of now the contraction of the ventricle, and that is the most important type of important type of verbs here. Here you can see that this prominent peak or this highest verb is known as the QRS verb. That is QRS verb. So QRS base is showing ventricular depolarization. Then there is one more verb, that is a T verb. That will be representing the ventricular repolarization, which is the electrical activity associated with relaxation of ventricle. That is, this verb, the third verb, that is a T verb, is they are taking place when ventricle are relaxing. So the first verb is the P verb that take place when auricles are contracting. QRS verb is the verb that take place when ventricle are contracting. T verb is the verb that take place when ventricle are relaxing. So this is how the different types of verbs are associated here. Then you can see that normally how the ECG is measured. The arms, legs, chest, etc. We will be placing different types of electrode, and they will be recorded, and there will be a amplifier will be there. and this amplifier, this is actually that will be taken to an amplifier. Amplifier will be multiplying this fine electricity, weak electricity several times, and that will be producing a graphical output like this. This machine is producing on a graph paper. So by looking on this graph, doctor can tell many things. For example, in a person, P wave is very small. What is the meaning of that? This is the normal size of the P wave. Instead of this size, it is only this size. That means your auricle is not contracting properly. On another person, if you look at the R wave, this is the normal height of the R wave. Instead of that R wave is only very small. That means that our ventricle is not contracting properly. Then if the T wave is also very small, that indicates ventricle is not relaxing properly. So doctor will be getting lot of information by simply looking at this graph. If a person, this wave is very short, it will be immediately indicating that that is contraction of the ventricle is not proper. If this wave is missing, that shows that ventricle is not relaxing properly. So that will give you a lot of valuable information for the doctor to understand whether the heart is working properly. So that is the significance of that. It shows the irregular heartbeat like arrhythmia, then myocardial infarction, heart attack. So many of the important diseases can be measured by simply taking an ECG. For example, the person had a heart attack. By taking the ECG, the doctor can immediately tell. So that is the significance of ECG. So analyzing the timing, shape of the wave and interval between different waves, the doctor can tell the different lot of information about the working of heart. We can see that how a normal ECG, this is the normal ECG, any deviation from this normal pattern indicates some kind of heart abnormality. So that is the significance of taking ECG, and this is an idea about the different topics that we have mentioned today. One is electrocardiogram, then blood pressure, hematopoiesis, ESR, etc.